Hello everyone, this is Ben and welcome to my channel, Chapter 3, Retirement. Today's topic is how did I know that I need to retire? Retirement is hard. The decision to make, for us to make that decision, say, to retire or not, it's hard. In fact, 4 years ago, I have another YouTube channel. I call it Changing the Tire. And at that time, yes, I was thinking about retirement. I was thinking about preparing for retirement. And 4 years later, now I'm still here, but I'm counting down, right? There's a calendar here. I have exactly 130 days before my retirement. And just a little background, I'm a practicing physician and I've been doing this for 38 years. I can remember the moment that that it hit me and say, hey, I really need to retire. And that was a few weeks ago, about a month ago. At that time, every day when we see patients, we have to document. We now use electronic medical record, and we have coders, people who come and review the notes and say, hey, what is missing? You need to do this and that. One day I received this note from the coder, and it says, please review, please verify the history, and so that things can be documented, whatever. I was like, okay, I normally do that. What's the problem? So I went back to that record, that chart, that patient that they were referring to. I look at the diagnosis, okay, diabetes and high cholesterol. Look at the medication, yeah, he's taking metformin, atorvastatin, so those are the medication for that. So I'm like, okay, I wasn't happy. I wasn't happy that they questioned me. It's pretty straightforward in my view. Anyway, so I sent back a nasty reply and said, chart reviewed, diagnosis, diabetes, hyperlipidemia, medication, atorvastatin, and metformin. Then I said, what else do you want, right? So of course I didn't hear back from this person, but eventually after a day or two, I realized that it was actually a component of that electronic medical record. And actually my medical assistant is supposed to click this tab right at the beginning of the chart, or somewhere near the chief complaint of the patient. You just have to click that. So somehow whoever was helping me that day with that patient did not click that. And for me, it was not part of what I need to do with the chart. I put the history of present illness, I put the exam, the diagnosis, assessment, and all those things, and I was done. I signed it. I locked the chart. But anyway, I realized that it was just something very simple. In fact, I have a note here in my computer where I said, now I learned to start from the very beginning before I close the chart to make sure that I click that, because whoever's helping me may not be my regular medical assistant. Anyway, so that's where I'm coming from, and I thought that's an interesting little topic to talk about. And I'm sure some of you who are watching, probably who already retired, you probably remember that moment, where you said, this is it, right? Or some of you who are still thinking about making that big decision. Yeah, it is a big decision, yes. Just like life, get married, get divorced, have kids, or changing job and all those things. Retirement is one of those big decisions to make, so it's not easy. And in fact, like I said, for me, I've been changing back and forth. In fact, there are two books here that helped me a lot recently. And one is this book. This is, of course, in Chinese. Dr. Dr. Ho. He was an anesthesiologist in Taiwan. At age 35, decided to quit and start to become a full-time writer. I was reading the book, and he was talking about all these positive things that we can change. He talks about, destiny. About, destiny is basically two components, right? Our personality and the decision that we make. As Einstein said, if you keep doing the same thing, expect a different result. It's called insanity. So same with our life, because of our personality, we keep making certain decisions, and then we have certain future and certain outcome of that, so most of the time we say, oh, it's just fate, it's just my destiny. But with that concept, it's all about what is your personality, how do you usually make decisions, and because of that you make certain decisions and you keep going this path. But the deciding point is, if you decide to make a different change, a different decision, then you go this path, And he even talks about the parallel universe concept, and I was like, okay, good, all right. Maybe I should keep working, all right? I just need to change my decision. So like I said, in the last few months, things get moving back and forth. And actually, interesting, in that book, a student wrote to him after his talk in the school one time, and the student mentioned about Mark Twain, all right? And I put it on the wall here. It says that, actually, let me get it to make sure I read it right. So it says here, 20 years from now, you will be more disappointed by the things you didn't do than by the ones you did do. So throw off the bowlines, sail away from the safe harbor, catch the trade winds in your sails, explore, dream, discover. So this was something that really, kicked me 2 days ago when I was reading the book. I say, yes, that's what it is, and that excited me. I say, yes, if I don't retire now and just wait and wait and wait, and what happens? In my previous video, in the introduction, I mentioned that 2 weeks ago, I thought I have 6 months to live because they found a tumor in my pancreas. And looking at the report, being a physician, I know that 90% probably it's cancer, right? And with pancreatic cancer, when you find it, it's late, it's metastatic, 6 months, that's about it, right? Thank God MRI showed that it's actually a cyst, so I'm still here. But that's another wake-up call, interestingly. So a lot of things kind of come together. And then another thing that I read from that book also was this other book, which is by Scott Adams. Scott Adams is known for his comic strip, Dilbert, and it's all about reframing, as it says here, reframe your brain. It's something like, if you think that I'm gonna walk the dog this morning and I'm gonna have a good time, relax, just walk, give them 10 minutes, and I have to go to work. But the reality is that the dogs, they don't walk like that. If you have dog, and I just walked my dog this morning, they're looking over the place, they stop, they want to look at the car, they want to bark at the other dog, they want to smell the pee of the other dog, whatever, and it takes time. So if that happened and it was different from your mindset, then you're not going to be happy. You're going to say, oh, it was like terrible, walking the dog is just miserable. But so basically what he's talking about is reframing. And as far as retirement or doing things, he talks about want and decide, right? If you say, I want to retire, well, there's a space there where you might come up with reason why you don't want, things are not going to happen. But if you say, I decide to retire, then that's a different perspective. That's a different purpose. If you decide, I decide to do this, then you put all the effort to do that, right? And during those days when you're still swaying back and forth, retire or not to retire, retire or not retire, then I think it gives a better purpose. So that's what it is. I try to keep the video short. So again, I can remember now the moment I remember, I tell myself I need to retire. How about you? If you retired, please put your comment down here if you're still like me, or now I'm more decided. So, but again, in the last few months, few weeks, things have been going back and forth. What are your concerns? How do you make the decision? And maybe you have a moment like what I had where you think, this is it, I need to stop. Okay, anyway, until we meet again, take care and be safe. Okay, bye-bye.